Next, it's my pleasure to introduce my colleague Yuming Guo from our school. Yuming heads the Hazelinks stream, which, as you'll hear, is all about linking with routinely collected health data. Over to you, Yuming.
Thank you, Michael. Hi, everyone. It's nice to meet you and you give some update for the Hazelinks. Let's maybe just give you some brief introduction for the Hazelinks. And we are responsible to do the exposure assessment for COVID-19 related cancer during the COVID period, and we link this exposure data to the routinely collected health data and the health survey data. Since the last annual briefing, we have already done a lot of work to link the daily variation of COVID related to 5 and the daily hospital admission, emergency department visits, mortality, and some other health outcomes that has already been done. And for the last year, we mainly focus on the identified linkage. So what is the identified linkage? This is based on the health survey cohort. We have the data from the elder survey cohort home address, and they will link this home address data with the COVID-5 related to 5, and then we link this each individual's data to the ambulance attendance data, cancer data, hospitalization data, mortality data. Then we can analyze the relationship between the exposure to COVID related to 5 and these health outcomes. But this exposure assessment is related to a medium, moderate exposure, that is 6 weeks exposure. This is not the daily variation, that is the 6-week average exposure. So that means we can a little bit understand the long-term effect of moderate effect. So what we have done, from the time and the location of each participant, so we can match the air pollution data to each participant, and then we can analyze the relationship between the exposure for COVID-5 related to 5 and the health outcomes like mortality, hospitalization, and emergency department visits, or maybe 2 or 3 years after the COVID-5 period. For this data, we have about 3,000 adult participants, and these participants are located mainly in Morwell. It's about 2,200 persons, and about 650 people are located in Seal. Okay, so this is the findings for the relationship between COVID-5 related to 5 and hospitalization. That is 4 or 5 years later after the COVID-5. So we can say, this results show, the 6-week exposure to COVID-5 related to 5 was associated with the increased risk of respiratory related hospitalizations over the following 5 years, particularly for the females. We did not find the relationship for other outcomes like cardiovascular disease and for the males. Maybe in the future, if we can do the further linkage, maybe with the increase of sample size, there might be improvement for the results. Okay, this is the results for the data linkage for cancer data. For this data, the overall incidence of cancer was higher in Morwell than Seal, but we did not find any statistically significant associations between the COVID-5 related to 5 and cancer and the incidence of the cancer after the 5 years follow-up. So, the main reason that this is still a sample size. For example, because cancer is a small probability risk, it might be need more sample size. We need to recruit. Maybe we need to do the further linkage in the next year and 2 years later. If this is a result for the emergency ambulance attendance data, for this data, we found exposure to COMI5 related PM5 was associated with the increase of ambulance attendances, for all the attendees, and specifically for respiratory and cardiovascular conditions. In the 3 years later, and we will still maybe do some work to to update the linkage to maybe to further the follow up, to increase the sample size if we can find other health outcomes result. Okay, here is the field plans. For example, we need to do some follow up, further follow up for the hospital emergency presentation, and for the cancer data, and for the mortality data, and for other health outcomes. And we would like to do some data linkage with the cardiovascular stream. For example, participants who were part of the cardiovascular stream, which can be included, as the blood pressure, ECG, and the inflammatory markers. We'll have their details. We will link them to the administrative health data set. We will do further analysis to look at if there is any significant associations for this outcome. Thank you.